Today I'm speaking to Nirja Joshi, who's an MBBS alumna from St George's. She went on to complete rotations in South Thames and came back to St George's to complete her GP training. She now works as a GP as well as being a fellow for Health Education England, and she also works as a dance teacher, which she's been doing for the past 4 years. So welcome, Nirja. Thanks so much for speaking to me today.
No, it's lovely to be here. Thanks for having me.
So I'll just start by asking you a bit about your current role and how it's changed over the last few months.
So currently I'm working as a GP in Southwest London. That's for part of the time. And as you mentioned, I'm a fellow for Health Education England. So that takes up a day of the week. For that, I'm doing a postgraduate certificate in healthcare practice, and I'm focusing that on the wellbeing of non-clinical staff in primary care. So we've done a lot of focus on wellbeing over the last year, and this was a gap that I thought existed. So that's something I'm looking into at the moment in that part of that role. And as you mentioned, I also work as a dance teacher. So this is something that I've managed to continue doing part-time on top of the general practice role. And I also am half of the WorkWell doctors, which we'll talk about in a little bit.
And could you tell me a bit more about the WorkWell doctors?
Yes, of course. So myself and another GP, Dr. Alexander Lai, we met at St George's doing our GP training, and we both connected over a mutual understanding for the wellbeing of healthcare staff. And this was all before the pandemic, and we saw that there was a huge gap for actually looking after our healthcare staff in all different departments as we went through our rotations. So as the years went on, we developed our ideas of what we wanted things to look like for the WorkWell doctors, and we were really hoping to run in-person events about promoting wellbeing and the different aspects of this. And then coronavirus happened, so everything that we'd planned then moved online. And this was an actual blessing of the COVID pandemic, because what it did is it shone a light on the wellbeing of healthcare staff, which had never been done in such a way before, and also allowed us to have an online platform. So that meant that we could actually give talks to different hospital staff. We could go to the north of England in the morning and go to London in the afternoon, which would have been impossible beforehand. So our reach has really increased through that. So a lot of the work we've been doing has been giving webinars and also doing safe spaces online. As you know, there have been very different phases of this pandemic. So at times there was very acute need for doctors to just have a safe space to be listened to and just to decompress. And then there's been some space for proactive wellbeing, which is a lot of the work we've been doing over the past 6 months, which is to encourage healthcare staff to look after their physical wellbeing, their mental wellbeing, and how to adapt the workplace given the fact that the ways of working have changed for healthcare staff over the last year. So in that, we've given some webinars to St George's actually for the Wellbeing Week, which was great. And we've also been to St George's back to speak to their paediatric department, which was wonderful because Alex and I both actually worked for the paediatrics department not too long ago. So it was lovely to be able to revisit them through the WorkWell doctors. We've also done work with the RCGP and practitioner health programs. So we've managed to have a really good reach over the last year, and we're doing a lot of work on our Instagram, which is at the WorkWell doctors, if anyone wants to give us a follow.
Like there's some really great resources there for students and for recent graduates who are at the start of their careers. And I know that you've touched on work-life balance a bit in the WorkWell doctors as well. For yourself, what have you done during this time to strike a good work-life balance, and what helps you stay positive?
So I think it has been really difficult to strike a work-life balance because all of the traditional methods that we had of decompressing from our busy healthcare lives had just disappeared overnight. So we lost our after work discussions with colleagues, we lost our lunch breaks to be able to meet other people and have that social space. And that was really difficult for a lot of people, but also for myself. I think the one blessing was that we were still allowed to go to work. So we were still allowed to see people, even if it was behind a mask, and even having that minimal human interaction, I think, has helped healthcare staff over the last year. But I think for me personally, I've been trying to create as much of a work and home division as possible. So we as GPs have remote working set up. So that means that a lot of our consultations are now done by telephone, and some of those we can actually do from home. But what I found was that days could go by and I would not take a break. I would not stand up from my work environment, just because there's a constant pressure to perform, and there's there's no one actually around you to monitor the fact that you're doing work. So there's a constant, people have often said that people are working harder when working from home than they were in the office. And I certainly felt that pressure. And obviously the demands on healthcare were huge. So the things that I was doing was making sure that I got out of the house. So that there's a thing called mimicking your commute. So because we have no space between the time we get up and the time we go to work anymore, which is when we would mentally prepare ourselves and set ourselves up for the day, it's really important to try and go for a walk at that time to just mentally prepare yourself for the day that's coming ahead. And equally, when you finished work, there was no space between work and home. You were at work 1 minute and then at home the next, and there was no space to decompress. So again, just getting yourself out of that environment, trying to talk to a friend or colleague on the phone if you can, and also making sure that they were in the right headspace to receive the information that you were going to give. So that's what I've been trying to do, and also obviously dancing.
Yes, you've spoken a bit about your dancing, and you've given some great advice there. I think that's good advice, not even just for healthcare professionals, but just in general for striking that work-life balance at a time when a lot of us are working from home, or as you say, you're working in front of the computer, you're doing a lot of quite intensive tasks. So you've spoken about how dance has helped you through that as well, and I know that you've held some dance sessions for healthcare professionals. Have you got any advice for how to stay active in a busy role?
Yeah, absolutely. So, I mean, for me, I think the biggest thing is to schedule in exercise. So, I think all of us are busy and all of us have time commitments. And I think if you leave it until the Monday evening when you are busy and tired and fatigued, the likelihood is you're not going to make that active decision to exercise. So, my choice is to schedule exercise classes, if possible, on a Sunday when I'm relaxed, and then I can fit those into my working week. So, 9 times out of 10, I will still be able to make that class because I've made a commitment to attend. Now, the other thing that I do is I teach dance. I appreciate that teaching exercise isn't a privilege afforded to everyone, but for me, that's huge. And being able to have the responsibility to lead others in exercise has kept me active as a consequence, but also it's just given me so much drive to want to stay active. So my top tip would be to schedule an exercise, and also remember that no amount of activity is too short. So something is better than nothing. And that's the mantra I've been having over the last year, because, you know, busy people don't have time. And with the RCGP over the last year, I created some dance fitness videos. So they're available on YouTube as well. But the most popular one was the 10-minute heart raiser. And the importance of that was that 10 minutes was actually enough to raise your heart rate, get you out of your desk, and get you a little bit sweaty as well. So it was incredible to see that we'd gone from a space where you had to go to the gym and you had to spend an hour in a class, or you had to dedicate a certain amount of time. Exercise snacking, as it's known, is actually really, really effective. So take whatever time you have, if it's 10 minutes, and just do something.
Yeah, that's really good advice, because I think that's really helpful to know that you don't have to do a lot, but every little helps. Like you say, if you can grab 10 minutes in your lunch break, it just makes all the difference, I think, just to your well-being, doesn't it? And just have a bit of a break from your work.
No,
Um,
definitely.
so I know you've spoken about this a bit already, but how have you adapted to new ways of working, and what's helped you do this?
So for GPs, a lot of our consultations moved remotely. So that meant that we were doing a lot more desk work. Now, general practice was already a sedentary job and we were aware of this, but you had a prompt every 10 minutes to at least get up and get a patient from the waiting room. Whereas now we find that we can be sat down for 4 or 5 hours at a time without the need to stand up.
Mm.
So for me, I think the important thing is setting up a good workspace. So a year into the pandemic, have you got a desk? Have you got ability to lift your computer up? So can you have a standing desk that's adaptable? And do you have any digital free time? So as we spend more and more time at the screen, we're finding that people are having more eye strain, headaches, musculoskeletal problems. So make sure that your workplace is adapted. Do you have the right desk? Do you have the right chair, the right screen height? But
Mm.
also, it's really important to see where you can take time away from the desk. So a huge thing that I've been doing this year is walking meetings. So there's a lot that you can do on Zoom, but actually, is there a Zoom meeting that you're attending but not having to participate in? So just listening to, can you take that on a walk around the garden? It's completely fine to do so. So think about actually how much you have to be glued to your desk and how much you can
Mhm.
stay away from your desk, and really do plan out your days and make sure you have boundaries between work and home. It's really tempting when you have a laptop that can access your work from home to just check
Mhm.
things on a Saturday or a Sunday. But would you have ever driven into work, unlocked the door, gone in and logged onto your computer? Probably not. It's because it's accessible to us. So we have to be careful about setting those boundaries too.
Yeah, I think setting boundaries, that's a really good point that you've made, because it's so much more difficult now to strike a good work-life balance. I think you've given some really good tips there. Um, and finally, I wanted to talk to you a bit about your role. It's been a very challenging few months, well, challenging year in healthcare. And what are some of the most challenging and rewarding things about your role?
So, in terms of challenges, I think all healthcare staff have faced a huge challenge over the last year in terms of the workload, dealing with COVID, dealing with loss. And I think dealing with loss has been a huge challenge to us. I always say that hospital doctors had a huge challenge of dealing with a mass of loss, and general practice had the difficulty of dealing with very personal loss. So the patients that we'd known over many years who passed away actually felt very different and difficult for us to deal with.
Mm.
So I think it's been a huge challenge actually over the last year to do that, and keeping a pace with a constant change of policy and procedure has been quite difficult. But I have to say there have been huge rewards over the last year. So the Workwell Doctors has managed to do some great work with wonderful reach over the last year. Without technology and people moving to those platforms, that would have been very difficult. And being able to teach dance to healthcare professionals and to see their feedback after the Workwell webinars or dance sessions, that somehow I've managed to brighten someone else's day who is actually going through probably a very difficult time, as we all have done.
Mm.
And the reach that will have will be on their family, their partner, and their patients, just to help uplift them. And that has been a massive reward, to know that even as an individual or a team, that we could have made a difference to how healthcare is being delivered in the north of England in the morning. Like that's it. That's an incredible reward. And being able to teach medical students. So we've had medical students from St George's and GP trainees as well that we've been training. Um, and being able to train, given the fact that we can do this online, has been a challenge, but hugely rewarding, because it
Mm.
allows us to participate a lot more. Had we had to travel to the university, it might not have been possible to engage with as much training as we've done. So yes, there have been challenges, of course there have been, over the last year, but we've really found some great silver linings and managed to help a lot of people in that time, which has been incredibly rewarding.
Well, thank you very much again. That's been a great conversation, I think, just about how you've adapted to some of those changes. You've given some great advice to students and new graduates and on what they can do to set a few boundaries between work and home life. And thanks very much for joining us today again, and have a great afternoon.
Thank you so much. Thanks, Heather.
Thanks very much. Bye.